introduce myself. Hi, I'm Bailey. I'm the nurse that's going to be changing your dressing today. I'm going to go ahead and verify the order that that's what they want. That's what the provider wanted. Can I go ahead and get your name and date of birth? Okay, he states his name and date of birth. Do you have any allergies that you need to be aware of? That I need to be aware of? Okay, he doesn't have any allergies. Are you in any pain? He's not in any pain, so I don't have to go check the MAR and give him pain medication. And if he was in pain, I would check the MAR, get the pain medication, and then I would come back in 30 minutes and see if that pain medication worked with him, and then I come back. All right, so I'm going to go ahead and perform hand hygiene. I have my bio bag right there. Perform hand hygiene. I'm going to put on my gloves. Okay, the side rails are going to be up. I'm going to put the bed to a good working height for me. I'm going to undo the dressing. I'm going to see who changed it last and see what time it was changed and the date. Okay. While I'm taking the dressing off, I'm going to be inspecting the wound. Throw that away. Alright. I'm going to look and see if there's any drainage. I'm going to look at the color of the drainage. I'm going to see if there's any odor. I would measure it, and then and where he has staples, I'm going to go ahead and count those. He has 1, 2, 3, he has 5 staples. And I'm still assessing. No drainage, no odor. The color's slight red. No signs of infection. Okay, and then I'm going to take off my gloves. I'm going to perform hand hygiene again. I'll go ahead and get my sterile gloves ready. And then I'm going to take this off without touching anything on the inside, because they're around the edges is not sterile. Okay. I'm going to go ahead and take my glove. I'm going to take my right one first. Okay, now I'm I'm sterile. Go ahead, throw that away. Go ahead and get my sterile fill ready. Okay, around the edges is not considerably sterile anymore, so I'm gonna go ahead and get all my supplies out. Okay. Get gauze, ABD pad, and my tape. And this is still sterile, so I'm going to go ahead and move it closer to me. Okay. The sterile field is also not touching the bed. Okay, I'm going to go ahead and get my alcohol swabs. I'm going to do the closest to me. Go down one. We'll go ahead and dispose in the bag. Okay. And then I'm going to switch this into my other hand, and I'm going to go down because I do not want to go over top of the wound. I'll go ahead and dispose. And then I'm gonna go ahead and remove it. Okay, and then I'm gonna dispose. Okay, then now I'm gonna go ahead and get my gauze. My ABD pad. Okay. Sterile is done. I can, well, I'm going to put my tape on. But doing tape, you do not have to do it sterilely if you don't want to. You can go ahead and take these off and put new gloves on. Okay, I'll go ahead and take off my gloves because I have no use for them anymore. Okay. I'm going to go ahead and get my pen, and I'd want to label where there isn't directly on the bandage. I'm going to go ahead and label the date, the time, and my initials. And then I'm going to go ahead and lower the bed. Okay. I'm going to go ahead and clean up my mess. And then I'm going to document any assessment findings that I found that was abnormal.